Hello and welcome to today's BSN examination review. This paper was done on 18th of July 2013. By then it was paper 4, but by today's standards, these questions are mainly found to be part of paper 2 examination, right? So let's get right into it. Question number 1. The nurse is caring for a client in a crisis. The nurse needs to understand that a client in crisis is alright, based on the options that we have. Right. Number one, it's commonly experiences, right? Experiencing psychotic symptoms is not a universal sign of this stage, right? Patients are going to react and present differently. Readily identifying and does not need, the patient needs support. The patient actually needs significant support in this stage, right? Should be singled out and assisted independently. We are saying that family support is very crucial to a patient who is in crisis. So the best option for us is the patient is usually overwhelmed, feels isolated, may not be unable to ask for help, so we have to be proactive and initiate that process. Question 2, the main emphasis of nursing intervention for a child with phobia is what? Number one is going to promote avoidance, which is not good, right? This one is going to promote avoidance and we have to leave it out. Allowing child to express, this is only part of a comprehensive care, so it's not inclusive of everything. Have the child face his fears, of course, this is encouraged, but it must be done with caution, right? So the best thing what we need to do, we aim to decrease fear and anxiety in a child with phobia. A response by the nurse that will indicate the use of clarifying technique in therapeutic communication is, oh guys, you need to review the lecture on therapeutic communication. But let's look at some of the options that are here that will indicate the use of clarify. Instead of talking about your spouse, I want you to know how you feel. This is redirection and not clarification. When did you first notice the feelings you are experiencing? When did you first notice? So this one is focused on gathering specific information and you are not clarifying anything at all, right? Tell me more about what you are thinking before you went in. So this is open-ended, it's for an exploration. The best statement that closely comes to what we really want about clarifying is, could you tell me please more about your experience, right? You want to provide more details. A common side effects of typical antipsychotics, neuroleptics, major tranquilizers include, of course, most of them are here. Looking at a neuroleptic malignant syndrome, this is a very serious one, but rare, right? It's rare, and we are looking for a common side effect. Most tranquilizers cause metabolic disorders that are characterized by hyperglycemia and not hypo, and this makes this one wrong. Oliguric crisis, this is a type of dystonia, part of the extrapyramidal side effects. Option D is the most common, and this normally happens due to the blockade of dopamine receptors. Right, so we have to start with D, then probably move to C. The most appropriate outcome for a client in acute episode of delirium is what? In delirium, we can go with A because we are aiming to reduce confusion and try and improve orientation for the clients. Function of management demonstrated by a nurse manager who is analyzing data on the number of hospital-acquired urinary tract infections in a medical ward. Is controlling and taking an action. Remember, this one involves monitoring performance, evaluating outcomes, and taking the key necessary correction actions to achieve the change. As a manager, your client's son calls you and asks you about the client's diagnosis for insurance purposes. The best response will be, I think all of us agree here, the main problem here is about privacy, right? So the best option for this one is privacy regulation. Don't require that we don't disclose client's diagnosis over the phone, right? Over the phone. Remember, if you are telling the mother that has improved, this one you are again sharing information, right, without verifying. You have no rights. This one you may be dismissing son's concerns, which sometimes may be genuine. D, kindly provide you information. No, here you are still going to go against the privacy regulations. The best action a nurse manager can take to prevent documentation errors is, I think if you look at all these, and the best will be educating staff on documentation techniques. If you look at reinforcing this may not be sufficient, as we need more practical steps. Punishing will not provide a learning environment, so this is punitive, it has to be avoided. Quick reference, this is just but a reminder. The hospital you work has guidelines that all medical wards must run controls on glucose monitors once daily. This guideline is an example of, I think this one was the easiest, about the quality assurance, right? Ensuring that there's accuracy and reliability of results from those tests. The best strategy that a nurse manager uses to foster a climate of collaboration on the unit is collaboration, because you have to display an attitude towards an open attitude towards new ideas and new suggestions, and this will help the company. A research problem is the one that is going to be describing the knowledge gap that needs to be described, that needs to be addressed in a research study. Disadvantage of using observational studies, like that individual values do not influence perception of the observers. Primary disadvantage of sociological measures, that they are the easiest types of methods to implement, and that becomes a problem here. An advantage of using existing records to answer questions, that it will going to number 14, is that you find that it's existing records, so going to reduce that research bias and collection. The two important values in research necessary for describing frequency, that you have that standard deviation and the median. Andragogy refers to adult learning. Behavioral objectives models in nursing education are also referred to as looking at the competence model. Disadvantage of problem-based learning is that they put so much pressure on the instructor is often anxious about covering their content. Advantages of role play is that as it all provides an opportunity for immediate feedback to the learners. In constructing multiple choices, lecturers should try and avoid completely implausible responses in the choices. Explain four rights of delegation. We have the right task, right circumstance, right person, right direction and communication, right supervision, and evaluation. Three factors that a nurse manager needs to consider when scheduling staff in his or her ward. You look at the patient needs. The nurse should consider the number of patients, their conditions, and any specific requirements to determine the appropriate staffing levels. You also need to look at the qualification and the competencies of staff of the staff members. You also need to adhere to the staff regulation and legal requirements. You also need to evaluate the workload associated with each shift. You also need to take into account staff availability, such as full-time or part-time or individual preferences. You consider the risk of fatigue and burnout. You also need to accommodate training session, orientation for new staff, and continuing education opportunities. You also need to understand teams dynamics and relationship among staff that can influence scheduling decision. The nurse should also have a plan of unexpected absences such as illness or emergencies, right? And this involve having on-call staff or float nurses available to fill the gap in the schedule as needed. Nurse needs also to work within the budget constraints of the organization so that you ensure patient standards are met. Explain the manager's role in implementing change, right? You, of course, managers are going to provide clear leadership by articulating a vision for change that aligns with organizational goals and values. This is going to inspire and motivate staff to embrace change. The nurse manager also needs to assess the current practices, identify areas for improvement, and gather data to understand the need for change. Now, nurse managers also play a role in communicating the rationale for change to staff and stakeholders. They also need to ensure the successful implementation of change, so they are responsible for providing education and training to the staff. They also involve in allocation of resources, including staff, time, and materials necessary for implementing change. After implementing change, of course, nurse managers will monitor the outcome and evaluate the effectiveness of the practices. Nurse managers need to be flexible and ready to address challenges that arise during implementation process. Nurse managers represent the interests of both patients and staff. They ensure that the changes in practice are patient-centered, focusing on enhancing patient quality care while supporting staff welfare and job satisfaction. Nurse managers have to promote a culture of continuous improvement and innovations within the teams. They encourage the staff to embrace change as norm and foster an environment where experimentation and feedback are welcomed. Or you're being asked to give an advantage of purposive sampling, two disadvantages of convenience, and one advantage of random sampling. In terms of advantage of purposive sampling, of course, it's targeted and focused. It's efficient for specialized studies. It's cost-effective and time-saving. It also provides an opportunity for in-depth information, and it's effective for exploratory research. In terms of disadvantage of convenience, there is lack of generalizability, and there is high risk of bias, limited diversity, lack of scientific rigor, and may not capture the target population. Advantages of random is that it reduces bias. There is that at least generalizability, increases reliability, it's simple to implement and promotes statistical validity, promotes researcher influence, and ensures population representation. Outline the major components of the following sections in a research report: discussion and conclusion. For the discussion, we have the interpretation of the results, comparison with previous studies, explanation of unexpected findings, implication of the findings, limitation of the study, suggestion for future research. Components of conclusion, we have summary of the main findings, significant of the study, recommendation, that is practical recommendation based on the findings, and the final thoughts. Those are concluding statements, a thorough provoking statement. 8 categories of population in research that can be considered is considered to be vulnerable and requires special consideration. We have the children and minors, right? So we need the parent or the guardian to consent is usually required, okay, along with the child's assent. Pregnant women and the fetuses, of course, they are vulnerable due to the potential risks that the research may pose to them, the mother, and the developing child. Prisoners, of course, they feel coerced into participating in research due to their constrained environment, right? So you have to ensure special consideration to ensure that their participation is voluntary and free of coercion. Elderly individuals, especially those with cognitive impairments, right? They may be vulnerable due to diminished decision-making capacity. People with mental disabilities, they have reduced cognitive or decision-making abilities. This makes them to be vulnerable for exploitation. Economically and educationally disadvantaged person, these ones may be vulnerable due to the limited access to healthcare or education, which could make them to be more susceptible to exploitation, right? Ethnic or racial minorities, this will be considered vulnerable due to the historical exploitation, discrimination, and marginalization in research. Individuals in emergency or life-threatening situations, people facing emergency may not be able to provide informed consent due to the emergency of their condition, right? Next, we have three difference between null and alternative hypothesis. Of course, the null hypothesis and alternative hypothesis are two key concepts in statistical hypothesis testing. They are used to make inferences or draw conclusion about a population based on a sample. So, looking at the null hypothesis, it's usually a statement that there is no effect, no difference, or no association between variables in population. It represents the default assumption or the status quo, and it is what the researchers typically aim to test against. It serves as a baseline that you try to either reject or fail to reject on the data. Example could be like in clinical trial, the null hypothesis might be that a new drug has no effect on patient outcomes compared to the placebo. So there is no difference in recovery rates between the drug and the placebo. Alternative hypothesis, which is abbreviated as H1 or HA, you find that it is the statement that contradicts the null hypothesis. It suggests that there is an effect, a difference, or an association between the variables. If the null hypothesis is rejected, the alternative hypothesis is considered to be supported by the data. It reflects that the researcher aims to prove or provide evidence for. Like in the same clinical trial, the alternative hypothesis would be that the new drug does have an effect on patient outcomes compared to the placebo. So the drug improves recovery rates compared to the placebo. So we have to know that the null hypothesis assumes no relationship or effect, while the alternative hypothesis assumes there is some relationship or effect. The null hypothesis is tested directly. If evidence strongly contradicts, it is rejected in favor of the alternative hypothesis. The alternative hypothesis, on the other hand, is indirectly supported by rejecting the null hypothesis. If the null hypothesis is rejected, we accept the alternate hypothesis as more likely. If the null hypothesis is not rejected, we do not conclude that it is true, but rather we say that there isn't enough evidence to support the alternative hypothesis. Master S, 16 years old, is admitted to the mental health unit with a history of attempted suicide in 2 days. You are called upon to describe how the nurse will assess the risk for suicide for Mr. S and also explain the role of mental health nurse in prevention of suicide among adolescents. Of course, the nurse will conduct a comprehensive suicide risk assessment for Master S, considering various factors that could indicate his level of risk. We can have evaluating suicide ideation and intent, so the nurse will ask direct questions to determine if Master S is currently experiencing suicide thoughts. Are you having thoughts of harming or killing yourself? The nurse will assess the frequency, intensity, and duration of these thoughts as well as whether Master S has a plan or an intent to follow through. You also explore the method and lethality of the attempt. The nurse will require about the specifics of the suicide attempt 2 days ago, such as the method used. Like, was there an overdose? Was he cutting himself or herself? Hanging, right? And whether the method had a high likelihood of causing death. Because understanding this will provide an insight into the seriousness of the attempt. You also need to assess precipitating factors where the nurse will explore recent stressors that may have triggered the attempt. This could include bullying, family conflict, relationship issues, academic stress, or a recent loss. So you need to identify these factors so as to help determine what has contributed to Mr. S distress. The nurse will also review Master S's mental health history, including previous episode of depression, anxiety, substance abuse, or previous suicide attempts. So, family history of mental illness or suicide is also important to assess. Also assess protective factors, behavioral and emotional signs, and also assess coping skills. As per your role as a mental health nurse in prevention of suicide among adolescents, you could do early identification and risk assessments. You provide emotional support, so this will provide empathetic listening and emotional support, creating a safe space for adolescents to express their feelings without being judged. Also, try and build a therapeutic relationship that helps adolescents trust you and feel free to share with you. Educate on coping strategies to deal with stress, relaxation techniques, journaling, physical exercise, and mindfulness practices. Involve the family and society in doing so, developing a safety plan and prescribe if maybe the patients are prescribed with drugs such as the antidepressants and other psychotropic medication, you have to ensure adherence to this medication regimen and also monitor for side effects. You've been appointed as the principal tutor of a nursing school. Then the school has a history of producing nurses who are incompetent in patient care. You purpose to reverse this trend by intensifying attitude and practical training. What are you supposed to do? You are required to explain five major categories or levels in the affective domain that your students must master before graduation, and also explain five advantages of OBSCE, objective structured clinical examination. The affective domain focuses on the student's attitudes, emotions, values, and behaviors. This domain is crucial for nursing students as it emphasizes empathy, clinical practice, and interpersonal relationship with patients. So according to Bloom's taxonomy, there are 5 levels within the affective domain that you students must master before graduation. Number 1 is awareness, where this foundational level where students are open to learning and willing to receive information. They demonstrate awareness of the importance of patient care, instructions, ethical considerations. Example, students pay attention during a lecture on patient communication. Next we have participation, where they begin to show interest and demonstrate a positive attitude towards patient care. Then commitment, where students start to attach value to the concepts learned, such as empathy and respect for patient dignity, and developing commitment to practicing ethical nursing care. Then we have now the prioritizing of values, where students begin to integrate their values and beliefs into their nursing practice. So they organize their priorities according to the patient care and professional ethics. Internalization of values, and at the highest level, the students internalize these values and demonstrate them consistently by being mature and having a professional identity with strong commitment to ethical and compassionate care. As for the advantages of OSCE, we have, of course, there are several, And OSCE is a key method in assessing nurse students' clinical skills in a standardized manner. You have standard assessment, so OSCE ensures that all students are assessed under the same conditions using consistent criteria, which increases fairness and reliability. OSCE also provides a range of skills, including clinical knowledge, practical skills, in communications, and decision making. This will allow students to demonstrate both their technical abilities and their interpersonal skills. Students often receive feedback immediately after completing each station. So this helps in identifying weakness and areas for improvement in real time, allowing students to correct mistakes before entering the workforce. OSCE also uses simulated patients and realistic scenarios to closely mirror clinical practice. So this prepares students to handle real life situations with confidence and competence. Lastly, we have the last one, whereby OSCE is objective and measurable. The examination is based on objective criteria with clear rubrics for evaluating performance. This makes the assessment to be measurable and transparent and allows more for accurate grading of each student's clinical skills. Okay, guys, that marks the end of the review of this paper 4, which we have indicated that most questions will now be found in paper 2 topics. And here are some of the paper 2 topics that we need to review.